Colorectal cancer is one of the most common cancers in the United States. The incidence is certainly increasing, and we believe that's because we are picking up more and more tumors at earlier stages because of screening and people going for proper evaluations to see if they have these diseases.
For people with an average risk, your first colonoscopy should be at age 45. It may be sooner than that depending on personal or family history. Then, depending on the results of that first colonoscopy, it can be anywhere from 1 to 10 years before your next one.
We often recommend that if the family history is a first-degree relative, that it's 10 years earlier than whenever that patient had their index colon cancer. For people with inflammatory bowel disease, we recommend starting screenings on average 8 to 10 years after they're diagnosed with inflammatory bowel disease in a more intense way. These are not hard and fast rules, and the best thing to recommend is that people with these problems consult with their physicians based on their individual situation to know what the best time to start screening is. Screening colonoscopy is done generally by gastroenterologists, and in an otherwise average risk patient, they have a routine colonoscopy looking for any polyps or potential precancerous or even cancerous lesions. The good news is the death rate from colon cancer has been dropping, and that's because people are being screened, the disease is being picked up at earlier stages, and we're able to cure people. So the message to people is, if you go for screenings at the proper times based on your personal risk, you have the best chance of picking up disease either in a precancerous stage or in an early stage of the cancer, where our chance to cure you is certainly the highest.